welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist. In this video, I'm going to go over rehabilitative Tai Chi for chronic low back pain. If you're experiencing pain in your low back, it is helpful to discuss this with your healthcare provider in order to determine the most appropriate intervention exercise for you. Before I begin, I want to speak a word of life from John 15:13. This is where Jesus says, "Greater love has no one than this, to lay down one's life for one's friends." Tai Chi, it is an ancient Chinese practice that combines gentle, flowing movements with deep breathing and meditation. And with medical Tai Chi, there's 4 components or 4 elements to it, and that's going to be movement, breathing, meditation, and self-massage. There are some different aspects that we want to make sure we hold throughout all of these, and one of them is going to be that inner smile. So how you approach life when we hold a smile on the inside, it is going to be expressed outside in our posture. So we want to think about smiling on the inside to help change from the inside out. We also are going to do fluid movements, coordinated breathing. So we'll focus on that inhalation and exhalation. We want to keep an upright spine, so constantly thinking of lifting the crown of the head up towards the sky. So we're going to keep an upright posture. We're going to go through slow and coordinated weight shifting from side to side. And then silk reeling. Silk reeling is when the energy is going to be rooted in the feet, released through the legs, steered at the waist, and expressed in the fingers. And throughout these different movements, we will be doing the silk reeling. So focusing on being rooted in the feet, the energy is going to be released through the legs, steered in through at the waist, and then expressed in the fingers. And there's going to be 10 strategies or 10 different movements that we'll go through, and I will just talk you through them as we go through these, and I will do them in this order, and you can stop and work on it, each individual exercise as you see fit for you. So let's start. First, we're just going to get in a comfortable position. We don't want to lock or straighten out our knees, so we're going to keep a soft knee bend. A neutral pelvis, so we don't want to have an arched back, so we don't want to be arched in our back, and we don't want to be overly flattened and rounded. We want to just keep that nice neutral spine and soft bend in the knees, keeping that upright, so we're keeping our crown lifted toward the ceiling. Now, with about 90% of back problems, the quadratus lumborum is usually involved, and that's going to be this muscle down here in the lower part of the back. We're going to start with scrubbing, so some of that self-massage. So as I keep my knees slightly bent, and I want all of these movements to feel non-threatening. So if you feel like you're feel threatened in any way, then you want to stop the movement. What I'm going to do is I'm going to take my fist and I'm just going to go in the sides there of that muscle, that quadratus lumborum, and I'm just going to start some what it calls scrubbing. So we're just going to scrub there. And we want to breathe while we're doing this. So I'm going to take a nice deep breath in and exhaling. And breathing in and exhaling. Breathing in. And we want to just spend a couple minutes here just scrubbing right through the lower part of the back. You can even do a little bit of percussion, so to speak. So you're just going to give different sensory input right in that area. So I'm just scrubbing, deep breath in, all the way out. Another breath. And then what I'm gonna do, so you're gonna find your navel next, and we're just gonna go just beneath there, and I'm gonna go in circles. So I'm just gonna do some small circles. Sometimes when we hold tension in that lower part of our abdomen, it can affect the back. So we're just gonna do some self-massage in this area, breathing in, and then going the other direction. And just spending some time working on that area. Keep breathing, holding your upright posture, staying relaxed, and just a little bit more. All right, next we're going to ring the temple gong. So what we want to do, we're going to stay rooted in our feet. The energy is going to come through our legs and then steered at our waist. So we're just shifting our weight side to side. And what happens in the feet is then going to be expressed all the way up into the fingers. So as I'm shifting, my spine is just rotating, and this should be non-threatening. Just relaxed in the shoulders, upright, inner smile. And you may feel stiff when you first start these, and then as you just learn to relax in the movement, get the weight shifting, slow that movement, just nice fluid movement, and just working on your breath. Inhaling, exhaling. Again, the movement should feel non-threatening. And I may want to do a little bit more rotation. My arms are just going to go along for the ride, just shifting back and forth. So the energy is going to start through the feet, released in the legs, steered at the waist or at the trunk, and then express through the fingers. Now we're going to do what you call over and under. So I'm going to take my hands and I'm just going to place them right on my pelvis. So underneath the low back, we've got our pelvis and our hips. So we're going to loosen up our hips. So we're going to loosen underneath the spine. I've got slight bend in my knee, and I'm just going to make small circles. This should be non-threatening. This is kind of like hula hooping. And you just want to stay in a non-threatening range. So just a small circle. You're just moving the hips underneath the spine. And it should just be nice and fluid. Then we can go the other direction too. And breathing. And you can start to make wider circles as you are able, or can stay in that non-threatening range. So if it starts to feel dangerous or any kind of pain, you want to reduce what you're doing or change until it is non-threatening. Let's go the other direction. Inner smile in the other direction one more time. So we're just loosening the hips, moving the pelvis. This is underneath the spine. Then we want to mobilize our thoracic spine, so we're going to go over, rooted through the feet. So we're doing that silk reeling. The energy is going to come through the legs. It's going to be released in the legs, steered through the trunk, and then expressed through the fingers. So we're going to just build like we're building up, just bringing in as this is going to look like a fountain. We're going to lift up, and then you're going to keep a neutral spine. So you don't want to be arched and you don't want to be rounded in your back. You're going to keep that nice neutral pelvis. And we're just going to gather up, gather, really nice and slow, controlled. Inhaling and then exhaling, reaching up. This is called supporting heaven, coming around and down. Inhaling all the way up and exhaling. Go through the front, so gathering. Up, pelvis stays neutral, exhaling. Shifting that weight. Should feel non-threatening. Shifting. One more. So that is over and under, hip circles, and then lifting and supporting heaven and extending that thoracic spine. The next one is going to be wind in bamboo forest. So we're going to lift through the crown of our head and then slowly going into that side bend, inhaling up and over, exhaling, coming back down, and then switching, shifting weight. The crown of your head's going up towards the ceiling, and we're going to come back down. So inhale, exhale. Slow. And it should be non-threatening. Neutral spine. Next is going to be long fold. So we're going to forward fold. Again, starting, hips are going to be a little bit hip width apart, and I want my knees to be soft. So I'm going to be rooted down into my feet. I want a neutral pelvis, neutral spine, and I'm going to start to use my hands to support my body. And I'm just going to slowly, slowly, slowly start to bend forward. and I can come to my knees. It should be non-threatening. If it's threatening, you want to stop. You want to see, do you have any tension in your body? And then we're going to start to round our spine, getting a stretch in that superficial back line. So here I'm just going to stop and inhale, going into a rainbow with my spine. And exhale, just relaxing. Inhaling. Exhaling. And if you're feeling like you can go further and you're just getting you're opening up the connective tissue on that back line, just working your way down, and then you can hang here, rounding the spine, taking breaths in and exhale. It should be non-threatening. And you can hang out here as long as you want to. And then I can start to work my way up. I'm going to use my hands for support, kind of rounding through my spine, slowly working my way back up. And inhaling. Then I'm going to go into Geico Press. So I'm going to take my hands, turn them inward, place them, work my way down. So slow working my way down. I'm going to hold my body weight here on my thighs. And then I'm going to drop one shoulder as I look to the opposite side. And inhaling, going one side. Exhaling, coming back to center. And then inhaling, going to the other side, dropping that shoulder. My weight is on my hands, on my thighs, so it should feel non-threatening in the back. So inhaling. Inner smile. And this and the prior exercise can be done in a chair, and I will go over that in another video. So inhaling. And slowly come out of that. Next, we're going to do cloud hands. So I'm going to get my feet a little bit wider than hip width apart, just nice and relaxed, soft in the knees. I'm going to bring my hands up here, and then I'm going to take one hand and I'm going to go down and across to that side. When I get here, I'm then going to rotate to the other side. And then switch my hands, rotating back. The ocean wave. So ocean wave, we're going to be rooted in our feet. So what I'm going to do is I'm going to put one hand on my heart, one hand on my abdomen. So I'm going to be one on my chest, one on my belly. And then I'm gonna move the energy from the feet. So it's gonna go to the front of the, I'm gonna go to the front of my feet. The energy is gonna go up through the legs and then steer through the waist. So it's gonna look like a wave. So I'm here, and it may be pretty wonky to start with, but you're going to just slowly make a wave. It's gonna look like an ocean wave. Crown of the head is gonna be up. So I'm putting my weight into the front of my foot, and then the energy is gonna go through the legs and then up into the hips. So it's, and the spine is gonna round. So the spine is rounding and then up into the head. It should feel non-threatening. Movement goes into the toes, moves through the legs. Next is going to be inner rivers. So inner rivers, we're going to be rooted in the feet. I'm going to turn my feet about 45 degrees. I'm going to use my arms. We're going to pull the breath in, and then we'll go down to one side, and it's just going to flow. We will down a little bit lower and coming back, and exhale. Going all the way down to the foot. And then switching sides and pulling in, inhale, and then exhale, going to the hip, inhaling, going to the knee, a little lower, breath in, breathing out. And that completes the Rehabilitative Tai Chi for chronic low back pain. Those are 10 different Tai Chi movements that can address chronic low back pain. You can break them down, do them at your own pace, and please leave in the comments below any movement you want me to break down and work on separately. And I hope this is of help. Have a blessed day. Thank you.